Papua New Guinea's effort to eliminate malaria includes a new initiative reaching across the South Pacific with the formation of a new trilateral cooperative partnership. The governments of China, Australia and Papua New Guinea have entered into the agreement, the first in the Asia-Pacific region. The project is a joint effort to enhance the current individual efforts of member countries with the goal to combat malaria not only by individual countries, but by pooling the resources to combat the disease. Mark Kayok reports.
Nearly 95% of Papua New Guinea's population lives in areas of high risk of malaria. This often affects the most vulnerable and represents a major health and economic burden which profoundly impacts on the country's development. Malaria infection was strongly AIDS-dependent, being most common with children aged between 5 to 9 and at least common in adults aged 20 to 39. Despite intensive control in the 1960s and the 2004 assistance from Global Fund to fight AIDS, tuberculosis and malaria in the country, more needs to be done. The governments of China, Australia and PNG have ventured into a significant trilateral partnership. This innovative cooperation project brings together the governments of the three countries to tackle malaria. The partnership signifies a new approach forward to work together in an on-the-ground health project in PNG to eliminate malaria endemic. This important program was launched last night. The launching of the program follows the signing of a Memorandum of Understanding on Development Cooperation between Australia and China in 2013 to enable practical collaboration on development issues in the Asia-Pacific region. Malaria is still prevalent in more than 97 countries, threatening more than 1.2 billion people around the globe. The launching of the trilateral pilot project is welcomed by the Minister for Health and HIV/AIDS, Michael Malabag.
And I am delighted as the Minister responsible with this important and very, very exciting partnership.
Minister Malabag said we need new approach and is supportive of the current approach, with his department working with development partners to finalize a strategy to eliminate malaria in our source.
For this strategy to be effective, it will be essential for us to improve our testing and diagnosis of the diseases.
In order for effective fight against the disease, it will be essential for us to improve our testing and diagnosis of the disease, and this project has the potential to significantly support the current development progress of eliminating malaria.
There is no doubt that if this pilot can develop appropriate protocols and mechanisms to work together, it will provide a model for a new way of working collaboratively on projects in the future.
The minister said he has also been informed of the wonderful healthcare organizations of China who are working in different ways to support healthcare in PNG, and is looking forward to this relationship growing in strength in the coming years. The government of China was pleased that three countries have started this pilot project, the first in the Asia-Pacific region, and China is ready to assist wherever it can.
Now, this trilateral partnership is a significant and strong collaboration. And it comes at the right time when the relationship among our three countries are in very good shape.
Huge progress has been made in China with the implementation of the China Action Plan on Malaria 2010 to 2020. Malaria cases have significantly fallen from the 30 million cases since the 1950s, a huge progress in China. Australian High Commissioner to PNG Bruce Davis said it's much better to work together to address malaria.
Clearly, being able to collaborate and work in a joined-up manner is so much better than all going off and doing our own thing. It is really quite important, I think, that we look more and more for opportunities to work in a collaborative manner, to look at ways in which we both bring different styles of expertise to the table to work together.
The Australian High Commissioner is happy that China is giving all it can to eliminate the disease in PNG.
The great efforts that China has been able to make in moving towards elimination of malaria in its own country can be drawn upon. Everything from Nobel Prize winners through to very many research stations, very many people with great expertise willing to share that expertise from China, I think is a great story.
The concept is in line with the Asia-Pacific government's commitment to combat malaria in the region. Australia will provide about 8 million kina to assist with the new program. The project complements the Australian aid program's focus on strengthening PNG's health systems by improving the capacity of key health issues. Present to witness the ceremony last night were Foreign Affairs Minister Rimbing Pato, senior government officials, Health Secretary Pasco Kase and members of the diplomatic corps.
Mark Kayok reporting there. This is PNG Tonight. Coming up, the historic church making a difference. Stay with us.